What if cold could change everything? The shocking truth. Your gateway to enhanced performance. That initial jolt of cold water is more than just a shock, it is a powerful signal to your entire biological system. It is a deliberate trigger for a cascade of incredible health benefits. Many people now embrace this discomfort. They step into cold showers and ice-filled tubs not for punishment, but for purpose. They seek faster muscle recovery after intense physical effort. They also chase a level of mental clarity and focus that is hard to find elsewhere. This practice, known as cold water therapy or deliberate cold exposure, is a tool. It is a tool backed by a growing body of scientific evidence, and it is accessible to almost everyone. This essay will serve as your guide into the world of cold water therapy. We will explore the precise mechanisms at play when your body meets the cold. We will unpack what happens to your blood vessels, your nervous system, and your brain chemistry. You will learn why this simple act can so profoundly reduce inflammation. Now, unlocking the body's code, the science of cold. When your body is suddenly immersed in cold water, it initiates a powerful and immediate survival response. This is often called the cold shock response. Your skin, which is covered in cold-sensitive receptors, sends an urgent message to your brain. The brain interprets this as a significant stressor, activating the sympathetic nervous system, the fight or flight branch. Your breathing rate automatically increases, you might gasp, and your heart rate temporarily spikes. This initial shock is the gateway to therapeutic effects, setting off a chain reaction of protective adjustments. One of the most critical adjustments involves your circulatory system. The cold causes blood vessels near the skin to rapidly constrict. Vasoconstriction. Diagram. Vessels constricting in cold and dilating in warmth. This preserves core temperature by shunting blood to vital organs. This process is highly beneficial for recovery. When you exit the cold water, the opposite happens. Vessels dilate. Fresh, oxygen-rich blood rushes back into tissues and muscles. That rapid change acts like a pump, flushing out metabolic waste like lactate. Cold stress also triggers a release of key neurochemicals. One of the most important is norepinephrine. When you get into cold water, a massive surge of norepinephrine floods your bloodstream and into your brain. Norepinephrine acts as both a hormone and a neurotransmitter. In the body, it potently reduces inflammation. Inflammation drives muscle soreness and DOMS. In the brain, norepinephrine increases alertness, focus, vigilance. That chemical surge is why you feel sharp and clear-headed after cold exposure. Now, recovery. From sore muscles to sharp minds, the recovery revolution. The application of these scientific principles has a direct and tangible impact on muscle recovery. After strenuous physical activity, your muscles are filled with microscopic tears inflammation. This is a natural part of the process of getting stronger, but it also leads to pain and soreness. By submerging the body in cold water, you actively combat this inflammation. Vasoconstriction, release of norepinephrine, reduce, swelling, calm, the inflammatory response in muscle tissue. This doesn't just mask the pain, it actively manages the underlying cause, allowing muscle repair to proceed more efficiently with less discomfort. Many professional athletes have made ice baths a non-negotiable part of their training regimen. Embarking on your cold water therapy journey should be a gradual and mindful process. The most important first step is to assess your health. If you have any pre-existing medical conditions, particularly cardiovascular issues, high blood pressure, a heart condition, Raynaud's phenomenon, it is essential to consult your doctor before beginning. The sudden shock of cold water places a heavy load on the cardiovascular system. Make sure your body is prepared. That's a critical safety step. This is a powerful protocol. Respect your individual physiology. You do not need to start with a full ice bath. Better to begin more gently. A fantastic way to start is with your shower. Finish your warm shower, then turn the water to cool for 30 seconds. Focus on your breathing. Take long, controlled exhales to calm your nervous system, resist the urge to gasp. Over several sessions, gradually decrease temperature and increase duration.